Good day everyone, I am Rizelle Angela Alcera and I will be discussing what is bronchiectasis. So first, let us have the learning content. We have the definition of bronchiectasis, causes of bronchiectasis, types, prevalence, pathophysiology, signs and symptoms, diagnostic exams, medical management, surgical and pharmacological management, nursing management, and prognosis. So, what is bronchiectasis? It is a chronic, irreversible condition where the bronchi and bronchioles become permanently dilated and distorted due to damage to their muscles and elastic tissue. This leads to abnormal widening of the airways, impairing the body's ability to clear mucus and making the lungs more vulnerable to infection. So, in simple terms, bronchiectasis means that our airways papuntang lungs is na-stretch out and damaged na. So, mahirap na siyang makaklear ng mucus. Bronchiectasis is caused by two phases of airway damage. First phase, we have the initial damage or insult. It starts when something harms the airways like an infection such as pneumonia, an inflammatory condition like asthma or rheumatoid arthritis, or other lung problems. This initial damage can weaken the airways, and in some cases, doctors can't find out what caused the first problem, which happens in 40% of people with bronchiectasis. The second phase is the vicious cycle. After the airways are damaged, they become more prone to inflammation and repeated infections. This leads to a vicious cycle where the inflammation and infections continue to damage the airways further, making the condition worse over time. So I will show you the normal bronchus and a person with bronchiectasis. So this is the picture. Um, Makikita dito yung normal na itsura ng bronchus, and then kapag may bronchiectasis ka, ito yung picture kapag nag-dilate and then maraming na-stuck na mucus kasi nga hindi na nakiklear ng ating airways yung mga mucus na pumapasok. So, bronchiectasis is classified in three main types based on the appearance of the affected airways. So first, we have the cylindrical or the tubular bronchiectasis. This is the most and least serious form, showing loss of normal airway tapering. So in this type, the bronchi are evenly widened and appear like a tube. So yung pag-dilate ng bronchi dito is uniform. So ipapakita ko yung normal na bronchi. Ito yung shape ng normal bronchus. And then, ito naman yung sa cylindrical bronchiectasis. Para rin siyang normal bronchus, pero yung sa cylindrical, nagda-dilate siya, and then yung pag-dilate niya is even or uniform. Next is we have the varicose bronchiectasis. It is the further distortion of the airway wall with more mucus and sputum production. So in this type, the airways are being stretched out and twisted. So isipin nyo na lang na parang varicose to sa legs, and then nag-a-appear siya ng parang wavy and lumpy. So ito yung picture ng varicose bronchiectasis. So ito yung varicose bronchiectasis with string of pearls appearance. So para siyang varicose sa legs na nagwi-wavy. Last type is the cystic bronchiectasis. This is the most severe form, less common, and bronchi form larger sacs at the end of the branches. So, as I've said, ito yung severe type, and then the bronchi are dilated into large balloon-like sacs. These sacs filled with mucus, making it very difficult for the lungs to clear out infections because of the large areas of dilation. This type often leads to significant lung damage and frequent infections. The sacs can also collapse, leading to areas of the lung not functioning properly. So, ito yung picture ng cystic bronchiectasis. Para siyang nagfo-form ng balloon. Um, we have the prevalence between 340,000 and 522,000 adults living with non-CF or cystic fibrosis bronchiectasis in 2013 in the US. There has been an estimated annual growth um, of 8% since 2001, partially due to advancements in diagnostic technologies, especially high-resolution CT scans. Bronchiectasis is often associated with COPD and is a significant cause of morbidity in patients with cystic fibrosis. Now we come to the pathophysiology. This is the pathophysiology of bronchiectasis. We have two factors, the predisposing factors and the precipitating factors. Predisposing factors are factors that make someone more vulnerable to developing bronchiectasis. We have the recurrent upper and lower respiratory infections in early childhood. So, frequent lung infections, especially in childhood, can damage the bronchial walls, making them more likely to dilate and lose their structure. Measles, influenza, and tuberculosis, these are infections known to damage the airways and lungs. If they occur frequently or are severe, they can lead to bronchiectasis. We also have immunodeficiency disorders. A weakened immune system cannot effectively fight off infections, leading to recurrent lung infections, which can damage the airways over time. Next is diffuse airway injury. Any widespread injury to the airways, whether from smoke, pollution, or other environmental factors, can contribute to damage and inflammation. We also have airway obstruction. Blockages in the airways trap secretions, leading to infections and subsequent airway damage. So we have the precipitating factors. These are factors that directly cause the development of bronchiectasis. We have the congenital diseases. Genetic disorders like cystic fibrosis cause thick mucus production that blocks airways and leads to bronchiectasis. Um, Also, sometimes the cause of bronchiectasis is unknown even after thorough investigation. So, in these cases, it is referred to as idiopathic bronchiectasis. So, these factors can lead to pulmonary infections damaging the bronchial walls. So, the repeated or severe lung infections can damage the walls of the bronchial tubes or the airways in the lungs, causing them to lose their normal structure and function. So, this infection leads to inflammation in the walls of the bronchi, making them swollen. So, these factors can lead to pulmonary infections damaging the bronchial walls. Repeated or severe lung infections can damage the walls of the bronchial tubes or the airways in the lungs, causing them to lose their normal structure and function. This infection leads to inflammation in the walls of the bronchi, making them swollen and irritated. With continuous inflammation, the structural support around the bronchi starts to break down. Normally, this structure keeps the airways open and functioning. When it is lost, the bronchi can become dilated and floppy, leading to the characteristic widening seen in bronchiectasis. You can also experience productive cough, airway obstruction, and abnormal breath sounds. So, as mucus builds up, it becomes thick and infected. The body tries to expel it through the productive cough or a cough that brings up mucus. The sputum is often purulent. The term purulent means it contains pus, indicating infection. you can also experience airway obstruction. As mucus accumulates and the airways become damaged, it becomes harder for the air to flow in and out of the lungs, causing dyspnea or the difficulty of breathing. It can also lead to abnormal breath sounds. The During a physical exam, the healthcare provider may hear rails or a rattling sound or crackles when listening to the lungs with a stethoscope. These sounds indicate that the airways are obstructed with mucus. The loss of supporting structures leads to permanent widening and distortion of the bronchial walls. Instead of the bronchi being firm and able to maintain their shape, they become stretched out and saggy. So it leads to impaired mucociliary clearance. In healthy lungs, tiny hair-like structures like cilia work to move mucus up and out of the airways in the bronchiectasis. Due to the damage and distortion, this process is impaired. Mucus can no longer be cleared properly, leading to its buildup in the airways. As the bronchial tubes dilate, the collected mucus can lead to the formation of lung abscess or the pockets of pus within the lungs, making infections even more severe. As the bronchial tubes dilated, exudates or fluid-like pus from infection can drain through the widened airways, but because of the impaired clearance, the body struggles to remove these secretions effectively, which can lead to hemoptysis. In severe cases, the chronic inflammation and damage to the bronchial walls can cause small vessels or can cause small blood vessels to rupture, leading to hemoptysis or the coughing up blood. Retention of secretions and subsequent obstruction affects peribronchial tissues. The mucus that can't be cleared from the lungs starts to build up, which causes obstruction in smaller airways. This leads to further damage to the surrounding lung tissues or the peribronchial tissues. Over time, the persistent inflammation and infections cause fibrosis or the scarring in the lungs. This tissue replaces normal, healthy lung tissue, reducing the lungs' ability to function properly. That leads to segment or lobe lung collapse or the bronchiectasis na. In severe cases, the airways become so damaged that part of the lung collapses or the atelectasis. This is because the lung tissue can no longer expand properly, leading to bronchiectasis in that specific segment or lobe of the lung. So as the damage progresses, the lungs become less able to perform their normal function of getting oxygen into the blood and removing carbon dioxide. This is referred to as the respiratory insufficiency. So, kapag may respiratory insufficiency, this leads to reduced vital capacity, which is the vital capacity is the total amount of air a person can exhale after taking a deep breath. But in bronchiectasis, this capacity is reduced because the lungs are damaged and can't expand or contract fully. It can also lead to decreased ventilation. Ventilation refers to the movement of air in and out of the lungs. But with bronchiectasis, the damaged airways cause decreased ventilation, leading to inefficient gas exchange. Can also lead to increased ratio of residual volume to total lung capacity. The residual volume is the amount of air left in the lungs after fully exhaling. So in bronchiectasis, this volume increases because the lungs can't fully expel air due to the obstruction and dilation of the bronchi. This affects the total lung capacity. This leads to ventilation perfusion imbalance. This occurs when the amount of air reaching the lungs is not matched by the blood flow through the lungs. This mismatch leads to impaired oxygen exchange, which is why people with bronchiectasis often experience low oxygen levels in their blood. So as a result of the ventilation perfusion imbalance, the lungs are not able to deliver enough oxygen into the blood, leading to hypoxemia or the low levels of oxygens in the blood. So one visible sign of hypoxemia is cyanosis, where the skin, especially around the lips and the fingertips, turns a bluish color due to low oxygen levels. Over time, this can lead to clubbing of the fingers, where the fingertips become enlarged and rounded. Next is the signs and symptoms. We have the repeated respiratory infections, chronic cough with large amounts of purulent sputum, hemoptysis, swollen fingertips with curved nails, shortness of breath or the dyspnea. Repeated respiratory infections. People with bronchiectasis often get repeated lung infections because their damaged airways trap the germs, making them more sick frequently. These infections are one of the main reasons why people with bronchiectasis feel worse over the time. Next is the chronic cough with large amounts of purulent sputum. Patients often have persistent cough that lasts for a long time. This cough is usually large amount of thick, purulent, or the pus-filled sputum, which can be yellow or green in color. This is due to the buildup of mucus in the dilated airways. Next is the hemoptysis. This refers to coughing up blood. It can occur due to inflammation and damage the bronchial walls. Some patients also may develop clubbing where the fingertips become wider and rounder. This is a response to chronic low oxygen levels in the blood. Next is the shortness of breath. So as the airways become more damaged and inflamed, it becomes harder to breathe, leading to difficulty in catching your breath or feeling short of breath. So we also have exacerbation symptoms or the worsen symptoms. It includes the extreme tiredness. Patients may feel an overwhelming sense of fatigue, which can be much more intense than their typical tiredness. This can affect their ability to carry out daily activities. We also have fever and chills. The increase in body temperature often accompanies exacerbations, indicating that there may be an infection present. Chills may also occur as the body responds to the fever, causing discomfort. Increased shortness of breath. Patient may find it significantly harder to breathe than usual. This can happen even at rest, making daily tasks feel more challenging. You can also experience night sweat. Excessive sweating during the night is another symptom of an exacerbation. Patients may wake up um, soaked and uncomfortable, which can disturb sleep and contribute to fatigue. So the diagnostic exams include CT scan, chest x-rays, sputum cultures, blood test, bronchoscopy, pulmonary function test. So CT scan is the most important and reliable test for diagnosing bronchiectasis. The CT scan gives doctors detailed images of the lungs, allowing them to see the dilated and damaged airways clearly. Next is chest x-ray. Chest x-ray is not as detailed as CT scan, but it can still show signs of bronchiectasis in some cases, like enlarged airways or thickened bronchial walls. However, mild cases may not be visible on an x-ray, so it's usually used as a preliminary test before doing a CT scan. Diagnostic exam also includes sputum culture. Sputum culture involves collecting a sample of the mucus that the patient coughs up, and then this sample is sent to a lab to check for bacteria, viruses, or fungi that might be causing or worsening the infections. Common bacteria found in the bronchiectasis include Pseudomonas aeruginosa and Haemophilus influenzae. Next is the blood test. It can help check for signs of infection like a high white blood cell count or for immune system problems that might be causing the bronchiectasis. These tests can also measure oxygen levels in the blood, especially if the patient is experiencing dyspnea. In some cases, doctors may use bronchoscopy to look directly inside the airways. This test involves inserting a flexible tube with a camera into the lungs through the nose or mouth. It helps doctors see if there are blockages, tumors, or foreign objects causing the bronchiectasis. They may also collect samples of tissue or mucus for further testing. Lastly is the pulmonary function test or the um, PFT. These tests measure how well the lungs are working. The patient breathes into a machine that measures how much air they can inhale and exhale and how fast they can breathe out. In bronchiectasis, the results may show obstructive patterns, meaning that the airways are blocked, making it hard to breathe out fully. Next is the medical management includes the chest physiotherapy or the CPT, postural drainage, antibiotics, bronchodilators, smoking cessation, and vaccination. Chest physiotherapy or the CPT involves percussion or clapping on the chest and back to loosen mucus, making it easier to cough up. Patients may also use devices like oscillating vests or handheld devices that help break up mucus. This is the postural drainage. This technique uses gravity to help drain mucus from different parts of the lungs. The patients are positioned in ways that allow the mucus to flow out of the airway so that they can cough it up. Antibiotics are crucial for treating infections and preventing flare-ups, especially since bronchiectasis patients are more prone to repeated lung infections. We also have bronchodilators. These medications, like albuterol, help relax and open the airways, making it easier to breathe and cough up mucus. We also have smoking cessation. Smoking worsens lung damage and increases mucus production and impairs the body's ability to clear mucus. The patients who smoke must be encouraged to quit and they should be given support like nicotine replacement therapy to help them stop smoking. Vaccination is also important because infections can make bronchiectasis worse. Um, it is also important for patients to stay up to date on their vaccination, especially for influenza and pneumococcal pneumonia. These vaccines help protect against common infections that can trigger exacerbations. We have the surgical management, the lobectomy or the removal of a lung lobe, segmental resection or the removal of a lung segment, pneumonectomy, removal of entire lung, but this is rare, and bronchial artery embolization or the BAE. Lobectomy involves removing an entire lobe of the lung. The lungs have different lobes, three in the right lung and two in the left lung. If only one lobe is badly affected and the rest of the lung is healthy, removing that damaged lobe can help the patient feel better and reduce infections. Next is segmentectomy. Instead of removing a whole lobe, just a smaller section of the lung is removed. This is called a segment. This option is used when only a small part of the lung is affected. Next is the pneumonectomy. This is only done in extreme cases when the lung is severely diseased and medical treatments aren't working. It is a very big surgery with risks, so it's only considered if absolutely necessary. Next is the bronchial artery embolization or the BAE. This is not exactly a surgery but a procedure used to stop severe bleeding or the hemoptysis in patients with bronchiectasis. So, sa procedure, yung doctor is nag-insert ng catheter, yung thin tube sa blood vessels, and um, the doctor guided to the bleeding artery in the lungs. Tiny particles are then injected into the artery to block it and stop the bleeding. Next is the pharmacological management. We have the antibiotics, bronchodilators, mucolytics, anti-inflammatory drugs. So, antibiotics and bronchodilators, diniscuss ko na kanina. So, mucolytics are medications that help thin the thick, sticky mucus that builds up in the lungs, making it easier to cough up. One commonly used mucolytic in bronchiectasis is nebulized hypertonic saline. Anti-inflammatory drugs helps to reduce inflammation and prevent further lung damage and reduce the frequency of exacerbation. We also have the nursing management, the patient education, airway clearance techniques, nutritional support, vaccinations. Patient education. Patients should understand the nature of bronchiectasis and how it affects their lungs and what they can do to help themselves. Airway clearance techniques is also important because it helps the patient clear mucus from their lungs to improve breathing, and this includes the chest physiotherapy and the postural drainage, which I have mentioned earlier. Also, nutritional support. Patients with bronchiectasis often have difficulty eating due to dyspnea or fatigue. So, we should do this by encouraging them to eat small or frequent meals that are easy to eat and digest, and educating the patient on staying hydrated to help thin mucus. Lastly is the prognosis. The prognosis for bronchiectasis varies based on factors like the underlying cause, severity of lung damage, response to treatment, and the patient's overall health. While bronchiectasis is a chronic condition that typically cannot be cured, many patients can manage their symptoms effectively and maintain a good quality of life with appropriate treatment. Early diagnosis is also important. Proactive management and patient education are key to improving long-term outcomes for individuals with bronchiectasis. So, that is all for my report, and thank you for listening.